Honorable members, let us pray. Almighty God, who in your wisdom and goodness has appointed the offices of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you have been pleased to call to the performance of important trusts in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our charge. Amen. Clerk, confirm that we have the quorum.
Mr. Speaker, sir, the House is not quorate.
There being no quorum, to commence the business of the day, I direct that pursuant to Standing Order 36, the quorum bell be rung for an initial 10 minutes or until such a time
Mr. Speaker, sir, quorum is now present.
Quorum have been confirmed. We proceed with the business of the day. Clerk, first order. Okay. Honorable members, pursuant to Standing Order 42-2, I wish to rearrange the business of the sitting such that we dispense with the business on the supplementary order paper and conclude with the main order paper. Clerk, first order.
Order number 1, administration of oath. Order number 2, communication from the chair.
No communication from the chair.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, statements. Mr. Speaker, sir, there is a statement by Honorable Paul Geshe-Wabaire, Chairperson, Committee on Health Services.
Honorable Paul Geshe-Wabaire, member for Kipipiri and Chair Health.
Thank you, Mr. Speaker. Mr. Speaker, I was on my feet and actually I had gone halfway of the report, so I'm going to take only 2 to 3 minutes so that I just concluded this report, this statement, and actually I was responding to Honorable Milka Wajiro Dirango, and being this is the year day, I first start by
for 5 facilities as alluded. Issue number 3, there was the status of county health personnel, including a list of health specialists in JM Kariuki Memorial County Referral Hospital. Mr. Speaker, on this matter, the department responded as follows. The county health establishment comprises all technical personnel recruited and working as healthcare personnel. There currently exists a glaring staffing gap occasioned by limited recruitment of new officers. Previous recruitment has only served to replace those who have exited service through natural attrition, resignation, or inter-county transfer. The current workforce is partly 30% of the recommended staffing norms. As a result, some facilities, that is dispensary, are manned by a single officer, while most health centers and the 2 hospitals work with inadequate staff. This is one area that impacts service delivery, resulting in long turnaround time and delayed. List of specialist doctors stationed at JM Kariuki Memorial County Referral Hospital. We have Kanda specialization numbers. For doctors, we have pediatrician 1, we have 1, gynecologist, we have 2, we have radiologist, we have 2, family physician, we have 2, we have 2 pathologists.
Question 4, as I summarize, whether all the departments in the hospital have adequate and sufficient working space for the staff. Mr. Speaker, on this matter, the department responded as follows. Currently, most of the department have adequate working space as recommended by the infrastructural norms. However, the space available for rehabilitative care, that is orthopedic, mental health, physiotherapy, and occupational health, is grossly insufficient given the high workload handled in these units. The kitchen space is also insufficient and renovation works for the new kitchen need to be expedited. The completion of the ongoing Mashujaa complex will sort out any gaps in personnel working space as inpatient services and other specialized services will shift there. Number 5, clear information on provision of specialized services such as cardiology, cancer treatment, and major surgery. Mr. Speaker, on this issue, the department responded as follows. The following specialized services are available at JM Kariuki Memorial County Referral Hospital. On radiology, we have CT scan, mammography, ultrasound, X-ray. Clinical, we have pediatrics, internal medicine, dental surgery, orthopedic surgery, general surgery, cytology, pathology, or morphology. The department does not have the human resource or infrastructure complement to offer cancer treatment at this stage. Our current scope in oncology care includes screening for malignancies and palliative care for end-stage cancer cases. For cardiology services, our family physicians are well capacitated to handle heart conditions that can be managed using medication therapy. Complicated cases that require surgical intervention of the heart are referred to the cardiologist specialist as per the existing protocols. The hospital has not had a general surgeon since the previous one left in 2019. We have since had one of our doctors who were on study leave undertaking masters in surgery resume. It is expected that we shall now be adding surgical cases going forward. Lastly, the status of JM Kariuki Memorial County Referral Hospital mortuary. Mr. Speaker, on this issue, the department responded as follows. The new JM Kariuki Memorial County Referral Hospital mortuary was completed and handed over to the department in September 2022. The mortuary operation were immediately shifted from the old mortuary since the new block has adequate capacity and affords more efficient handling of bodies. On committee observation, committee in the process of analyzing the above information noted the following. JM Kariuki Memorial County Referral Hospital is not yet RFO 5 hospital and hence has not been receiving funding from the national government as RFO 5 hospital. That JM Kariuki Memorial County Referral Hospital currently has a general surgeon who is a doctor who will assume duty from a study leave for master degree in surgery. Number 3, that CT scan machine is operational and serving clients from the neighboring county. 4, the Department of Health is critically understaffed across all cadres, that is doctor, nurses, and other health professionals. In fact, the staffing level is less than half of what is required by level 4 hospital. Madam Speaker, through a site visit conducted to JM Memorial County Referral Hospital on 29th November 2022, at a consultative forum with the CCM Health thereafter, the committee learned that JM Kariuki Memorial County Referral Hospital is on a path to achieving level 5 status. This will enable it to provide a comprehensive set of services, including internship for medical staff, research, and serving as a training center for paramedical staff. This will have a positive impact on the revenue collection within the county, Madam Speaker. On conclusion, human resource in health department continue to be a major challenge in Nyandarua County, both in numbers and capacity. The biggest challenge being the conflict between meeting the set human resource norms and standard and remaining with SRC set limits of expenditure on personnel emolument. The county government through the CPSB should move with speed to ensure that this is achieved in the county. Thank you, Madam Speaker, and have a wonderful International Women's Day. Thank you.
Thank you, Honorable Paul Ngeshe. Do we have any responses on that statement thought? I am giving this opportunity to honorable members to comment, to debate, or rather contribute on that motion or statement, because the seeker, I'm informed here by my able clerk that it is to comment on that motion, not debate. Since the speaker is not around, any member wishes to comment? I guess not. That statement seems to have fully satisfied the honorable members. Honorable Ngeshe, thank you so much. Clerk?
Order number 8, the motions and bills. Madam Speaker, there is no business to be transacted. We proceed to the main order paper. Order number 1, administration of oath. Order number 2, communication from the chair.
No communication.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. There is a paper by Honorable Isaac Congo Wajiro, Madam Speaker. Madam Speaker.
Honorable Kongo, the chairperson budget.
Thank you, Madam Speaker. Madam Speaker, I want to seek leave not to table the report. Today, Madam Speaker, I'm expected to table a report from the Committee of Budget and Appropriation on approval of the emergency fund expenditure. Madam Speaker, the reason I don't want to table this report today is because, Madam Speaker, you realize that it is not precedented in this assembly since 2013 devolution. We have never had this paper presented in the assembly, though it is a requirement by law. The section 114, section 1 of the PFMA Act requires that the executive member of finance, committee member of finance, seek approval of the county assembly within 2 months after payment is made from the emergency fund for approval or ratification by this assembly. This has never been done since 2019. So I want to congratulate the current regime, led by His Excellency Honorable Badrisha, and the CEC in charge, Honorable Manjiko, for making the first attempt to seek the approval of this assembly to ratify the use of the emergency fund. Despite that fact, Madam Speaker, after looking at the report, we have discovered very serious anomalies in terms of registration, and hence we feel that the report that we have requires some more consultation with the executive. The report is ready, but we need...
Is it Honorable Kasana? Sorry, Honorable Kongo.
Is it in order for the Honorable Member, Chairman of Budget? He has not tabled the report, the paper, and he has started discussing the paper. I think he is out of order.
Honorable Kasana, have you said? The chair has granted Honorable Kongo a few minutes to explain himself and why he's seeking leave. So, Honorable Kongo, continue.
Madam Speaker, I understand Honorable Kasana. You know they are used to come to this assembly and just seek leave without giving reasons. So he is having very difficult when I explain why I am seeking leave, because he is used to come here and say, I'm seeking leave without giving reasons.
Honorable Kongo, kindly have a seat. I will invite the Honorable Minority Leader for a point of order.
Madam Speaker, I find the member for Wanjoy completely out of order. Since when did he become the prefect of knowing who is seeking leave and who is not seeking leave and how he seeks that leave? Madam Speaker, it's completely wrong.
I want to fully agree with the Honorable Minority Leader that indeed, Honorable Kongo, you slightly out of order. Withdraw those sentiments and proceed.
Thank you, Madam Speaker. I withdraw, but I want Honorable Kasana, in due respect, to listen to what I'm doing so that he'll be able to understand. I'm actually, because he was in a point of order, that is why I'm responding. Madam Speaker, I'm giving a reason why we are not tabling the report. And I'm saying, and I want this assembly to understand, that this is not precedented. We have discovered there are serious issues in terms, there is a gap in registration when it comes to regulation and policy on emergency fund. And we felt that if you are going to table the report the way it is, it will not have given any value. Because whether we approve this money or not, it is not consequential, because the money has already been spent, because it is emergency. So we felt that we need like 1 month more. We sit down with the executive together with the Emergency Fund Committee, so that when we give recommendation, we'll give recommendations from that report that will inform future spending of emergency fund. So I seek leave for at least 1 month, Madam Speaker.
Thank you so much. I think that leave should be granted. So it is granted, Honorable Kong. Clerk?
Order number 6, as per your direction, the order is dispensed with. Order number 7, other statement.
Order.
Other statement, there is a statement by Honorable Simon Bogomboro, the Chairperson, Committee on Public Works, Roads, Energy, Housing and Transport.
Do you realize, Honorable Mbogo, you have been called to move your statement?
Thank you, Madam Speaker. And before I start talking, Madam Speaker, I don't know what is disturbing the honorable member from Magumu. He shifts away from Wanjohi. Now he's in Wanjohi. I don't know what is really his problem. Madam Speaker, I'm standing in for the Committee of Roads to seek relief for the response of the statement. The reason as to why we are not able to table the response is that we had a lot of issues and some job when we were trying to look into the approval hearing, where our days we are lapsing today. So we are seeking leave. We are going to compile the report because we have already gone for site visit. We will be tabling the report on the statement in the next preceding sitting, if allowed by your leave and the House Business Committee. Thank you, Madam Speaker.
Is the seeker of that statement in the House? Then I think you seem to be lucky, Honorable Mbogo.
Point of clarification,
your leave has
Madam
been...
Speaker.
Yes, Honorable Ngesh.
Madam Speaker, maybe you need to clarify to this House whether Honorable Hussein Kasana is properly dressed, because in my view, he is completely out of order.
I'm going to take a minute to consult on this matter.
Point of...
Because I can see that Honorable Kasana as a level, some level of dressing, and the coat is missing. So we will...
Point of order. Point of order. Point of order. Point of order,
Madam Speaker. Point of order, Madam Speaker.
Clearly, the honorable member was not dressed. I mean, that matter has been dispensed. Are you still there, Honorable Kathongo, on that matter?
Madam Speaker, it's very wrong when a honorable member comes with a tubukat in this assembly, Madam Speaker. So...
Order, point of order, Honorable. What is a tubukat? Kathongo? Honorable Kathongo, sorry.
Whatever Honorable Kasana was wearing, it doesn't even cover the stomach. So that is the tubukat, Madam Speaker.
We dispensed that matter because he volunteered to walk out and go and dress properly. So you still have not clarified what a tumbukati is. I don't think that statement is a parliamentary. Desist from such. Clerk? Honorable Mbogo, your leave was granted. Clerk?
Order number 8, other motions and bills. There is a motion by Honorable Mwangi, the leader minority. Mwangi Gishuki.
Thank you, the minority leader.
Thank you, Madam Speaker. Madam Speaker, I beg to move the following motion. That pursuant to Standing Order 29 and 32, this House does resolve to adjourn to a day other than the next normal sitting day, such that this House does adjourn from today, Wednesday, 8th day of March 2022, and resumes on Tuesday, 21st day of March 2023 at 9:30 a.m. This, Madam Speaker, is necessitated by the need to look at one of the most critical and important documents that is the enabler of the development for the next 5 years of this particular country, that is the CIDP. It is known that the executive are done with it, and it is required of us to go through the CIDP to ensure that the contents they are in is the true reflection.
Can you put your microphone closer to your mouth, Honorable Minority?
Is there a way you put volume up? Okay. But Madam Speaker, I was saying that we are seeking that we adjourn to the 21st because we have that document, which is the CIDP. The CIDP, Madam Speaker, entails the plan of what we expect the government to run for the next 5 years. It therefore is prudent that all of us have enough time to scrutinize the document before its approval. And therefore the request is that we adjourn to the 21st to allow those few days in between the 8th and the 21st, give members ample time to go through each department within the CIDP and for purposes of its approval. Thank you, Madam Speaker. I call the Honourable Member for Wajohi to second.
Thank you, Madam Speaker. I want to second the motion for adjournment, and I want to say that the reason that has been provided by the minority leader is sufficient because, Madam Speaker, as you know, we are almost late with the budget making process because being a transitional year, we were expected to have approved the CIDP by the end of December so that it could have enabled the preparation of the consequence document, that is the ADP and the CFSP, which means that the CFSP was supposed to be tabled in this assembly by the 28th of February. And we are late. So I feel it is very important now that the executive has already given us the CIDP. We move with speed so that we are able to pass the CIDP in this assembly so that we can be able to work out on the ADP and the CFSP. So, Madam Speaker, I support that next week we need to sit down, and I call upon all the members and humbly request that this is a 473-page document. It is a 5-year plan document. Let's take time. Read. Let us familiarize with the content of that document because it will be our Bible for the next 5 or 4.5 years. And I'm sure that this House is going to give justice to that document. Thank you, and I appreciate the House Business Committee and the Speaker for allowing this House to have this adjournment motion to go and look at that serious business. Thank you, Madam Speaker.
Thank you, Honorable Minority and the member for Wanjoy, Honorable Nkomo. I now want to propose the question that pursuant to Standing Order 32, this House does resolve to adjourn on a date other than the next sitting. Sorry, let me repeat that. That pursuant to Standing Order number 32, this House does resolve to adjourn on a date other than the next sitting day, such that this House does adjourn from today, Wednesday, the 8th day of March, and resumes the 21st day of March on Tuesday, 2023 at 9:30 a.m. Yes, Honorable Misha.
Thank you, Madam Speaker. Madam Speaker, I rise to support that this House be adjourned since CIDP. It is all about 5 years. And you see now, we need to iron some of these issues because you've heard the seconder saying that document is 473 pages.
maybe the document I am having is having 486. So we need to go and harmonize and see what is in these extra pages, and also be able to capture every details that they are in. However, Madam Speaker, I have some reservations, and this goes to the executive. Now that we are dealing with the CIDP, despite that we are it, they should not try to bring other documents, like now the ADB and the county physical strategy paper. This will be an ambush to this house. So now that we've adjourned to deal with the CIDP, they just give their separate time to deal with it, so that we can get things right in our county. And Madam Speaker, running the mood of the House, I call the mover to respond.
Yes, minority.
Can I use two? Yes, Madam Speaker, I just want to appreciate the members having dispensed on this. And maybe just put one remark that really all the members must note that we are saying this is a critical document. Whatever it is going to be agreed that we are converging, it is critically important that everybody avails him or herself, especially those people who represent specific words, the 25. Because if you lose it at this point, don't blame anybody, because this is the framework of the project that can be undertaken within your ward between now and the next 5 years. And therefore, it is one of the documents you do not treat with contempt. Thank you, members, and thank you, Madam Speaker.
Thank you, members. And I want to put the question that pursuant to Standing Order number 32, this House does resolve to adjourn on a date other than the next sitting day, such that this House does adjourn from today, Wednesday, the 8th day of March 2023, and resumes on Tuesday, 21st, the day of March 2023 at 9:30 p.m. As many as of the similar opinion say aye. Aye. Those of the contrary of the ayes have it, and the motion has been passed. Next order.
Madam Speaker, the business of this sitting as appearing on the order paper has been exhausted.
Thank you, members. We resume the House again on Tuesday, the 21st day of March 2023 at 9:30 a.m. Thank you. We adjourn, rather.